The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Last week, we promised you more with Dr. Newsom, and here it is. If you haven't listened to part one, be sure to go back and listen to that first.
Many parents have a lot of concerns around the safety of vaccines. Can you walk us through what the testing and approval process looks like for them? We hear so many different things on, the internet, especially TikTok. TikTok has a lot of feelings about how vaccines get approved. So can you tell us a little bit about what that process actually looks like?
Yeah, so vaccines, like any other medication, are going to go through all the normal clinical trials. And really, there's no other medication that, one, is used so widely, and two, monitored consistently for safety and efficacy, right? Because we're not just monitoring for safety. We want to make sure our intervention is effective well. So that's always the two pieces of it. So when you start a vaccine, you started a scientific process where you're going to make sure in a lab that it works, right? And then you're going to make sure in animal studies and all those things. That's what I did in my undergraduate degree. I worked in a lab. We made mouse models for things. We, used mice to, make sure things were safe and effective and prepared for human trials. And then all FDA approval will generally go through 3 stages of clinical trials. One, where it's a small clinical trial, normally 50 to 100. Second size will probably be somewhere between 500 to 1,000. And then it'll go to phase 3 clinical trials where you'll have tens of thousands of people, right? We recently saw this with COVID vaccines. We recently saw this with RSV vaccines for pregnant women. We've seen the same clinical trials working their way through. And in each step, we're looking for negative side effects. We're looking for intolerance, but we're also assessing for effectiveness. Are we getting an appropriate antibody response? Are we actually doing something with this? The vast majority of medications that come to market are in their 3rd, 4th, 5th, 6th rendition. They failed clinical 1 trial because they weren't effective or because they had a negative side effect. They failed clinical 2. So it takes literally oftentimes 10 to 15 years to get a medication from the scientific laboratory where undergraduates and people working for National Institute of Health are doing their science to actual something that'll come to market. And all vaccines have undergone that. The other interesting thing about vaccines is they're always tested against the current gold standard. So when the first vaccines come out, there was no gold standard, right? So they were testing against people who aren't vaccinated. How often do they get sick? People who are vaccinated, how often do they get sick? Now, our goal is to test it against the current vaccine or the current gold standard, right? Because it wouldn't be ethical for us to have children not have the current gold standard of care and then compare that to the other one. You can't say, okay, well, we're just not going to vaccinate kids for a generation, see what happens, and then revaccinate and see how that goes, right? That would be unethical because we're exposing, especially children, to known risk. So when we also test vaccines, we're also testing it along with the other vaccines that we're receiving. That's a really important part. So if you read the vaccine insert, you're always going to say, this vaccine was tested in conjunction with whatever other vaccines are looking at, MMR, DTaP, Prevnar, whatever. And these patients received this. Lots of times, if there's not a consensus, meaning all the patients in the trial are not getting the same other vaccines or same medications, that data is excluded because then you're not comparing apples to apples, right? So not only are they tested against the previous gold standard of the vaccine or medication, they're also tested against other vaccines as well. And then they're monitored for many years. A unique thing about vaccines, and this is oftentimes a question that I get when people are hesitant about vaccinations, is why does the vaccine adverse event monitoring system exist, right? If vaccines are always safe, why do you need VAERS? And that's the proof of how important and how serious we take anything that we're giving on such a broad field to everybody. If for whatever reason a medication got through clinical 1, clinical 2, clinical 3 trials, and then suddenly was deemed not safe, we want to know that. And so we have this system, which is anybody can submit, right? Like anybody can go submit. Practitioners can submit. Anybody with internet access can go submit and tell their experience. And those are all treated like a tip line where we can see, are there patterns emerging? Is this still causing problems? And we can see vaccine reactions that could have happened 10, 15, 20 years down the line. And we take those very seriously because vaccines, without a doubt, are the single most prescribed or given medical intervention. And we want to make sure that they're always, yes, interacting well with each other. We have a minimization of side effects, and we want to make sure they're effective because I don't want to be giving an intervention that's not effective.
I also think, in alongside that VAERS comment, you also will hear people say it's not fair because the pharmaceutical companies can't be held medically responsible if something happens. And I always hear the response, and I wonder if it's similar for what you think, is that, well, yeah, because they're not going to keep making it if they're just going to be getting sued if they, keep people saying, well, your vaccine did X, Y, Z. So they have to be protected or else no one's going to want to do it because it's a huge liability because they're giving it to all of these babies. So can you kind of tell us your perspective on that?
So my perspective on that is the same one. I mean, when people say, well, this person proved in court that their vaccine caused their children's illness or whatever. And I always say, I don't let lawyers dictate how I practice medicine, right? Because their job is not to use the science to make the best scientific decision. Their job is to get a winning verdict for their client, right? And so the same reason we have separation of church and state, we have these separations and we need separation between law and science where politics does not influence how scientists practice science. And otherwise, you're going to have a party line, right? Whether you're Republican, Democratic, Independent, whatever, your vaccination status should not be based on your political party. It should be based on your conversation between you and your physician. I always talk about so important to have that rapport with your pediatrician because if your child does have an adverse reaction, your pediatrician should say to you, we're not going to do that one. And we're going to count on everybody else's herd immunity around you to keep you safe. There's no one size fits all, right? Vaccines are not safe for 100% of people. They are safe for 99.999. But if you're one of those 0.0001s, you definitely want to make sure that all your friends and family are keeping you safe from measles because you can't get that vaccine.
Yes. So can you tell us a quick little, tell people what herd immunity is?
Yeah. So herd immunity is when you're the little baby buffalo in the middle and all your big mama and daddy buffaloes are circling the wagons and keeping you safe for whatever reason, right? There's a lot of ways that each of us benefit from community, right? Whether that's social or religious or, just personal, we benefit from the group's presence, right? And vaccines create what's called a herd immunity, where if everybody's vaccinated against something, there's no way for that disease to take a hold in the community because it can never penetrate that outer wall of bison's horns. But if one of those bison decides to go take a grass break or take a poop break, all of a sudden the wolf can get in and can not only attack the vulnerable ones, but can spread that among even sometimes healthy populations that may have a weak ankle or a weak knee or an exposed backside, right? So herd immunity is where the vast majority of people are vaccinated. So if you were to throw a dart, 99.9% of the time, you're going to hit a vaccinated person. And the chance that that vaccinated person would then be infected to the next person is even less because statistically, if you're the 0.001% person, they can't infect the next person and it just stops that domino effect. Where you see right now, for example, in Oregon, once again, we're having measles outbreaks, right? We've had 36 cases in Oregon, and they're exclusively among the unvaccinated population, right? It's because when that disease butts up against somebody who's vaccinated, it stops the domino right there, and that's fine. But if it is in an unvaccinated community, the dominoes fall down and the herd immunity is not there to protect them.
That makes sense. So I've got another kind of spicy question for you here.
Great.
Common fear that we hear both on the internet and from some of our parents is that doctors are maybe pushing for vaccines or pushing for medications due in part to like kickbacks from insurance companies. Can you speak to that a little bit?
I'm still waiting on my check. It's been 10 years. So pediatrics, we'll talk bluntly, all right? I'm a very blunt person.
Let's do it.
Pediatrics is the lowest paying field, right? Like out of all the specialties, we make no money. And that's because a large amount of kids are on public insurance, right? And public insurance, specifically our Medicaid populations, which is different in each state, don't pay as much as private insurances. But we don't care because we're not there for the money, right? If we were there for the money, we would burn out like everybody else. But we're there. We have low burnout rates because we're there working towards with patients that are awesome because adults suck. But so the reason why pediatricians get vaccines has nothing to do with money, because we actually generally lose money on vaccinations because there are so many monitoring programs that we have to abide by in order to even have vaccines in our clinic. The refrigerators are ridiculously expensive. The monitoring systems are ridiculously expensive. In our clinic, not too long ago, we had an error in our monitoring system. It wasn't even the fridge. And we had to throw away tons of vaccines. And they cost thousands and thousands of dollars. That was like a huge hit for us. It's because so people think that because there's like things like quality metrics that exist, all right? So when you work with an insurance company or work for the state says, for each state, they'll set their metrics. Like you have to screen 70% of teenagers for depression. You have to screen 80% of teenagers for smoking or drug use. You have to make sure your sexually active teenagers are on birth control. You need to screen your moms for postpartum depression. And one of those things is you need to make sure your vaccine rates are this level. We don't get paid for individual metrics. Like I can't make money if all my metrics are super low, but my vaccines are super high, right? I only get paid, and this is like you either don't get paid or you do get paid, if all of my metrics meet this quality standard. So it's like having a star rating. So each clinic tries to maintain their metrics as high as they can, but that's for all of these healthcare standards. You would not want me to stop screening our moms for postpartum depression. You would not want me to stop asking teens if they're having sex and getting them on birth control if needed. You would not want me to stop talking to teens about drug use. Those are all parts of quality healthcare. Obesity and BMI also go into this. There's so many metrics that go into this. Vaccines is just one part of making sure that our whole healthcare is quality. And it's all about making sure that doctors aren't just doing patient mills where they just come in, they see 60 patients, they send out 60 bills, and they got it. It's making sure that doctors are doing their job and saying, we're not going to pay you as a state, as an insurance company, if your patients aren't healthy and you're not doing your job and showing us that you're doing your job.
And so that is why there are some pediatricians that will not take people that are doing an alternative schedule or even no vaccination at all, because they can only have a certain percentage of their population that is their clients or patients that are deciding that. Is that what you're getting at there?
I don't know. So as a practice, we do take unvaccinated kiddos because we feel that every kiddo needs to be taken care of. And many times those unvaccinated kiddos, they need more care. They need a sharper eye on them, because if that 4-month-old who's unvaccinated comes in with a fever, my differential diagnosis has to be much broader. I can't say, it's probably not meningitis, it's probably not ear infection pneumonia, because they don't have their vaccines. So as a practice, I can tell you why we choose to see unvaccinated kiddos. One, we spend a lot of time on education. So I will go into a room, and if they've chosen not to vaccinate, I will normally spend 10 or 15 extra minutes in that room, obviously decreasing my number of patient visits a day, doing that education, because I don't care about the money. I don't care about the compensation. I care about the kid and their health outcome, right? And education is really the key to helping people understand the misinformation that they're being exposed to 99% of the time. The other reason is not sometimes, all pediatric clinics are going to have medically fragile kids, right? Pediatricians by default are the people that get referred to for our kids who are ventilator dependent, who are G-tube dependent, who are cerebral palsy kids, are oncology patients. they're not going to go see a family practitioner very much. They're not going to go see, urgent care. They're going to have a pediatrician to handle that complex level of care. And many pediatricians feel the risk of having a unvaccinated kiddo, especially in a state where there's active measles or pertussis, coming in and compromising that child who, vaccinated or not, is so medically fragile. It's for the safety of their patients as well. Because even if you have a healthy waiting room and an unhealthy waiting room, there's unhealthy kids in the healthy waiting room and there's healthy kids in the unhealthy. You can't expect parents to differentiate that. So I think most pediatricians, it's more of a safety liability for their patients, right? Where the parents don't want to know that there's going to be kids that could get their kiddo sick with something that they may not be able to be vaccinated for. And I don't think I know a lot of pediatricians just from circles I run in. I don't see many of them saying it's because we're not going to meet our metrics. It's because we need to keep our patients safe. And some people just don't have the time to give that higher level of education.
Yeah. Dr. Newman, I have approximately 1 million more questions for you, but I'm going to let you go. I have so many more questions I could ask you.
You schedule it good. It's okay.
Yeah,
I love to talk about the subject. It's great.
It's so good. And as a mom who was that one that did not want to vaccinate and was like so literally terrified. And I remember signing my son up for his first set of vaccines, and it was 3 weeks away. And twice within those 3 weeks while I was waiting, he had really weird things that he did. And I was just like, I'm somebody who believes in God. And so for me, I was like, thank you, God, for like having him have this before his vaccine. Because if what happened right now, like he broke out in a weird rash, and then the other one, he just started doing this high-pitched scream in the middle of the night that he had never done before. And I was like,
babies
both
are
of
so
these
dumb.
things, just so dumb. I was, both of those times, if that was right after his vaccines, I would have blamed the vaccine. And I'm not saying some parents don't have actual vaccine reactions. I'm not saying that. But for my child, I know that that's what I would have thought. So this information is so helpful, and we just thank you so much for being here. Will you tell people real quick how they can find you?
Yeah, well, the easiest way is Dr. Rossum, Dr._ROSSOME on TikTok. I have a small Instagram page too. It's really just about not just vaccines, it's just about child's health in general. The goal is to get pediatric specific information with no paywall, right? You can watch it. We dance, we sing songs, we do boring talking ones, we break down vaccine inserts. There's playlists about autism, MTHFR, vaccines, everything that a parent could want.
Yes. This has been so good. I'm someone who just loves numbers and research and all of these things. So I'm just like totally so excited about all of this. So this has been awesome. Thank you so much for coming on. And
thank you.
We would love to have you back anytime.
All right. Let me know.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.